Hi, thank you so much for joining me today. I have Professor Dunaway with me, and she worked at Toro Hospital during Hurricane Katrina here in New Orleans in 2005. So, thank you so much for being here. Can you walk me through your journey at Toro from your very first day on the job to the moment you had to evacuate during Katrina? What were your first impressions, and did anyone talk about hurricane risks back then?
Absolutely. So I have a really unique situation. I moved to New Orleans on August 14th. 2005, my first day at Turo was August 22nd. And anybody listening knows that Katrina hit on August 29th. So on my first day at Turo as a dietetic intern in orientation, they talked about how if there was a hurricane that we would have to stay, but they said that that had not happened in a long time and the likelihood was low. I'm sure there was a binder or a piece of paper or something about what that would look like, but it was not communicated in detail. So what happened was when it became clear that Katrina was going to hit New Orleans, we had pagers back then in 2005, and we were all paged, I guess, that Saturday and knew we had to report to the hospital that Sunday before it hit.
Before Katrina hit, so what kind of emergency or hurricane preparedness plans were in place at the hospital? Did it feel like you were truly ready, or was there a sense of uncertainty?
I will be honest and say because I was at such a low level, I am sure that there were plans in place, but I was not privy to them. The plans that I were privy to were there's a list of essential personnel. And so my team was considered essential because we had to feed not only the employees that were essential, but employees that were essential at the time. It was policy at most hospitals in New Orleans that they could bring up to a certain number of family members. I think it was five or six. And
Wow.
so they could bring those people to shelter in place at the hospital. That is no longer allowed because of what happened with Katrina and so many people having to be evacuated after. Um, I do not feel like any details were communicated to me other than show up and help feed people. And I think a lot of the reason why my experience was so traumatic is because I wasn't prepared. I wasn't from here. I'd never experienced a hurricane. And so to be working in a place where I was required to go in as support staff for a disaster, um, yes, was very overwhelming.
I really can't even imagine that, especially given the quick turnaround you had from your first day at work and the day that the hurricane hit.
Yes, and I also should mention that the CEO of Turo at the time, he started the same time we started as interns, so he was in his first month of employment. Obviously there were people at the hospital who had been there long term, but there it was a lot of the leadership was new, and certainly in my position, I was not prepared.
Once we get to the hurricane itself, what was the communication like between the staff, between the hospital and the outside world, with the patients' families? Were you getting updates or did it feel like y'all were cut off?
I think one of the most important things to contextualize is this is in 2005 and people didn't have smartphones. And so I did have a cell phone, but it died because by the time the hospital was on generator power, we were not using generators to plug in cell phones. And so we were getting information from um, the radio. There was a parent of another intern who was with us, and so we were getting information from the radio. There were some TVs in different parts of the hospital, or information was being communicated to us from our supervisor. I do want to be very clear that my experience at Turo was not as extreme or severe as some of the other hospitals in New Orleans in terms of the severity of what the patients were experiencing. However, there was very limited communication, and a lot of it was either happening by word of mouth, so things were maybe misrepresented. Um, they were happening through like limited TV or radio at the time.
Okay. And you mentioned the patients. So what kind of patients were still at the hospital on Monday morning when Katrina hit?
The only patients that remained were patients in intensive care units. So if there were people, for example, the interns, we were sleeping on the floor of a break room in the neuro ICU. So like neuro ICU patients were there. I honestly do not know, what other critical patients they had there. My assumption would be like general ICU or cardiovascular ICU if they had one at the hospital at the time. Everyone else who was not in critical care was discharged though. So it was just critical care patients.
So the hospital had critical care patients, all the staff, and then staff's families.
Mhm.
So it was full.
The largest volume, the largest number of people who were in the facility were the family members of the people who were there.
And did you feed them as well?
Yes. And to feed all I think it was like 5 or 600 people. I'm not sure. The one thing, I don't know if you have this in another question, but this will be interesting to listeners. A lot of hospitals get deliveries on Mondays, and Katrina hit on a Monday, so there was no food delivery. So we were having to feed people with whatever was left over, or non-perishables, and the combinations were very strange.
And so, kind of piggybacking off that communication, were did orders or your role in the hospital change throughout the course of the storm, or was it just the same the whole time? Feed people, take care of yourself, keep
Yeah,
going.
it was the same the whole time. So, like, our directive was to support the food service staff. And so we were either helping prepare food, or we were on the line, like serving people, or we were taking food to patient rooms, which makes me now wonder and ask. So, this is an aha moment for me. We were going to patient rooms to get trays. So maybe there were people there who weren't critical who were
Right.
eating because we were actually going to rooms to like pick up trays. Because the power was out, there was like one elevator running on generator power. I did refuse to use it. So we would like walk up 10 flights of stairs to like get trays and walk back down. My role did not change until there was the announcement that the levees had broke. And so I then became very non-essential, and they had us self-evacuate first because when they realized that they needed to get everybody out. I became non-critical.
And how did that announcement go for about the levees breaking and the self-evacuation?
It was very haphazard. It was word of mouth. It was not, I could not even tell you to this day who told me. I think the communication, it was either the parent of the intern who was in the room with me, or either it was our internship director. Everything happened very fast. The hurricane hit Monday, and we went outside actually with the CEO at the time. We just happened to be downstairs. We walked around outside on Britannia for those familiar with the area. It looked like a lot of limbs down, and I was like, I'm going to see my family at the end of the week. Later that night, I was going to take a shower, and a nurse was like, "Are you prepared to be here for 2 weeks?" And I was like, "Say what now?" And she was like, "We'll be sheltering in place." And I'm just like just kind of rolling with the punches. We woke up on Tuesday morning, and everything moved really quickly, and it was like less than an hour that from the time I woke up to the time I was in my car caravanning behind other people. And I didn't know the city at the time. I had no idea where I was going. It was probably less than an hour. So things are very chaotic and moving very quickly. But it was definitely word of mouth because there was no other way. I mean, there's no way that they would have communicated. Maybe they communicated with the hospital intercom system, but I don't remember.
Right. And also, announcing an evacuation over an
Is
intercom system doesn't
not a
sound,
good idea.
that sounds chaotic. Yeah. It sounds like the whole process was relatively chaotic, especially
Yeah.
in terms of evacuation because of that, that unpredictability on that Tuesday
Yeah.
morning.
Yeah.
Um, all right. And kind of given all of that and the fact that you returned to New Orleans to complete your MPH a year after Katrina, what do you think Katrina revealed about the strengths and weaknesses of hospital systems in New Orleans during disasters?
I was like, it's like rapid fire. How do I answer? Um, I think that, it exposed, a lot of weaknesses, but I do not mean that in a critical way. I just mean it in a way that the city had not ever experienced a storm of that magnitude, nor had that been very many mandatory evacuations in the lifespan of the people who were in charge at that time. It might sound unconventional now to think of that many people going to shelter in place, but a lot of people in the city didn't have transportation out, nor could they afford to evacuate. And so um, I think there were a lot of things. There's documentaries and books and conversations of the things that it exposed. I think it also highlighted the extreme nature of connectivity and community in New Orleans because everything was happening in such a chaotic way. Everyone had to rely on someone else, and I think that it highlighted the strengths in terms of people kind of the communal nature of like lending a hand and helping if I had to pick a positive.
Well, thank you. And that last question, you kind of summed it up there, but how did that experience shape the way you think about your work, or about healthcare more broadly, healthcare in New Orleans, today?
I can honestly say that that experience was the most transformational experience of my life. I would not have been interested in public health. I would not have it changed my worldview, it changed my political views. I don't think that everyone in life has one event that they can kind of look back at and say that really changed the trajectory. And for me, it changed everything. It changed where I did my dietetic internship. It changed where I did my master's. It changed, like I said, it changed my political views. It turned my worldview upside down. And I, it impacts everything. Uh, it impacts my personal life. Like I never would have met my partner because he came down here like doing rebuilding work. I wouldn't have the children that I have. I wouldn't have the degree that I have. But from a health equity perspective, for me, that was the first very big crack in my belief that health is an it's about individual responsibility, and it was
Wow.
a very, very, very big crack in that belief system, and just really understanding all of the other social and economic determinants of health.
Yeah, that's an incredible adjustment, and to witness it so firsthand.
Well, and I will add one more short thing. I think this was a long time ago. This was 20 years ago, and we didn't know a lot about trauma-informed practices. And so I processed none of this with anyone until about 5 years ago. So I went about 20 years um, without really processing it. And the other thing that I will add is that my entire public health education was in the context of a post-Katrina New Orleans and a post-Katrina Tulane. And so for better or for worse, that really was the lens and context with which I learned public health. I learned how to be an adult. I chose my career. Um, so it's yeah, I think the outcome would have been very different if something like that had happened today with what we know about trauma informed practices, but we didn't know. So,
Yeah, well, a life-changing experience to say the least.
yeah, yes,
And thank you so
that's
much
the
for,
tagline.
right. And thank you so much for sharing it with us. I really appreciate your time today and your
You're
thoughtful
welcome.
answers and everything. Especially given the trauma and the weight of this topic. I'm really fortunate that I got the chance to hear about it and learn about it from you. So thank you
Well,
so
you're
much.
welcome. There's a lot of growth. There's a lot of growth in sharing.
Right? Of course.